Hello guys, welcome back to the pharmacotherapy series on Pharma Palette. Have you ever wondered why two patients with asthma don't receive same treatment even though both have the same disease? Why does one patient need only one inhaler while the other requires multiple medications? In today's video, we are going to answer those questions by understanding the complete asthma treatment strategy from the treatment goals till the treatment algorithm in a simplest way possible. So, if you are a PharmD or PharmD PB student or anyone who's preparing for exams, stay with me till the end because once you understand the logic behind the treatment algorithm, remembering the asthma treatment becomes much easier. So, without wasting any time, let's get started. So, starting with the goals of the treatment, first thing is to reduce the symptoms. Second one is to prevent the future asthma attacks, to improve the quality of life, and to reduce the ADRs of medicines, and to maintain normal lung function. Coming back to the types of the asthma treatment, there are two types of managements here. First one is the chronic management, and second one is the acute management. So, chronic management is usually done for long term treatment, and this acute management is a kind of a rescue treatment. So, coming back to the chronic management, which is usually a long term treatment, in this, the main focus is to prevent the symptoms. Second one is to control the airway inflammation. So, this chronic treatment mostly includes all of these. First one, you need to use the controller medications. Second one, you need to do the regular follow up. Third one, you need to give the patient counseling regarding the medications which has to be used, how to use and all. And you need to also be avoided to certain triggers which are causing asthma. So symptoms control monitoring is required. In the acute management, the focus should be mostly on treating the sudden asthma attack. So in this treatment, it mostly includes rapid symptomatic relief should be provided, and if needed, oxygen therapy should be given. And sometimes in acute management, bronchodilators can be used. That too, short acting bronchodilators should be given, and whenever it is indicated, corticosteroids, systemic corticosteroids can be used. So, hospital referral for several attacks can also be done. Let's try to see the chronic asthma management. So, to understand this chronic asthma management, just remember a simple trick, that is PAIR MS, where P means it is patient education, A means it is assessing the asthma control, I means it is identifying the risk factors, R means it is to review the inhaler technique, M means it is following or ensuring the medication adherence. S means it is the stepwise therapy. Now let's try to see what exactly is done under each one. So first one is patient education. So in the patient education, patient should always understand, you should make the patient understand about the nature of the disease and also the correct inhaler technique and the main importance of the regular therapy, and also you should be able to tell him the difference between the controller and the reliever inhalers, and he should be also be able to know the early warning signs because early warning signs can sometimes worsen the asthma. So he should be always be able to identify that, and he should also know when to seek the medication help. So these are all the things which you will be providing during the patient counseling. And next one is A, which is assessing the asthma control. During every follow up, the things you need to evaluate are that first one, you need to check the daytime symptoms and also the nighttime symptoms. You should also know the frequency of the reliever use, how long he is using that, and also the lung function. All of these factors should be evaluated during every follow up. Third one is identifying the risk factors. Here you will be identifying the causes of asthma. You'll be checking if the patient is having any kind of comorbid illnesses or if the patient is using the incorrect inhaler technique. So that you will be identifying. So the next one is page review inhaler technique. So in the review inhaler technique, you should always check the correct use of, always provide the proper inhalation technique to them, and also you can show the patient demonstration. So re-education should be provided if needed. Next one is ensuring the medication adherence. So medication adherence is simply the following of the prescription. You should check if the patient is following the prescription correctly or not by checking if the patient is missing any doses or what is the reason behind not following the prescription. So is it the cost issues or is there any kind of side effects fear? You need to identify and ensure the medication adherence. And the last one is S, which is the stepwise therapy. So this stepwise therapy in the chronic asthma treatment usually helps to control the symptoms and to know the risk of exacerbations, and also you'll be able to identify the frequent attacks of asthma. So coming back to the some other treatment strategies. So next one is the rescue medication. Simply here you will be taking reliever medications. So what is reliever medication? Simply these medications will be providing the quick relief to the patient. It will be making them relief from the symptoms like wheezing, shortness of breath, chest tightness. Immediately there will be relief provided. And this will be relaxing the airways, thereby causes the bronchodilation. So these are given only when it is needed. Coming back to the next one is controller medication. So controller medication is simply given in the maintenance therapy. So like these drugs are taken regularly. Reduce the airway inflammation, to prevent the symptoms, and also to decrease the risk of getting the future attacks. And the next one is acute asthma management. First thing you'll be doing is assessing the severity. Second one, if the patient is in the hypoxia state, you can provide the oxygen therapy. You can also give the rapid acting bronchodilators. Disease is in the moderate to severe state. Systemic corticosteroids can also be added. And even after doing all of these treatments, if the patient is still showing any poor response, in such conditions, you can also refer to the hospital. The last thing you'll be doing is the follow up. Now, let's try to understand the treatment algorithm of asthma, which usually follows the stepwise approach, which is recommended by GINA. So, GINA means it is the Global Initiative for Asthma. The treatment in asthma, it is started according to the patient's symptoms and their severity and the level of asthma control. If the asthma is uncontrolled or if it is severe, in such conditions, the treatment will be stepped up. Once the asthma is controlled for at least 3 months, then the treatment will be gradually stepped down under the medical supervision. Now let's understand each step one by one. Begin with the step one. So, this is mainly for the patients who are having the mild intermittent asthma. The meaning is that these kind of patients usually experience the symptoms occasionally, and in these conditions, the preferred treatment is by giving the reliever medications. So, reliever medications like this inhaled SABA, which is short acting beta 2 agonist, will be given. Like salbutamol can be given. This is only used when the symptoms occur, not every day. In some patients, doctors may also prescribe a low dose corticosteroid whenever SABA is used. So, this will be helpful for reducing the airway inflammation, and also it will be reducing the risk of getting the future attacks. So, coming back to the step 2, which is a mild persistent asthma. Like step 2 is simply if the patient's symptoms are occurring more frequently, the patient will move to the step 2, which is mainly meant for this mild persistent asthma. So, here we will be giving the controller treatment. So, here we'll provide low dose inhaled corticosteroids. As this asthma is an inflammatory disease, reducing inflammation is our key for the long term control. So, if this ICS is not used, in such conditions, the alternatives like leukotriene antagonist like montelukast or zefilokast can be used. Or sometimes low dose theophylline may also be considered. So, step 3 is mainly for the asthma which is not controlled on the low dose ICS. Now, imagine that the patient is taking the low dose inhaled corticosteroid, but the symptoms are still not well controlled. In such condition, the patient will be coming to the step 3. So, here the preferred treatment is you will be giving the low dose ICS. Along with that, you will add a long acting beta 2 agonist. If this combination is not suitable, there is an alternative treatment. There, you will be increasing the dose of this ICS. Along with that, you will be adding one leukotriene receptor antagonist. So, next one is the step 4. Step 4 is mainly for the moderate to severe persistent asthma. So, if asthma still remains uncontrolled, the patient will be entering into this step 4. At this stage, the preferred treatment is medium or the high dose inhaled corticosteroid that is given along with this long acting beta 2 agonist. So, additional medicines. So, additional medicines like this leukotriene receptor antagonist, which can be montelukast or zefirlukast. So, theophylline may also be added if needed. And patients at this stage may also require the evaluation by the specialist. And coming to the next one, which is the last step, which is step 5. This is mainly for the severe uncontrolled asthma. So, even after providing the optimal treatment, if the asthma is still not controlled, in such conditions, these patients usually require the high dose inhaled corticosteroids. Along with that, this long acting beta 2 agonist will be provided. And in some cases, the oral corticosteroids or new biologics like omalizumab can be given. All these are the advanced therapies. Treatment at this stage should be managed by the asthma specialist. And that's the complete overview of asthma treatment strategy and the GINA stepwise approach. Remember this, good clinicians don't memorize treatment. They understand the reason behind every treatment decision. Once your concepts are clear, even the most difficult pharmacotherapy topics become easier to understand. So in the next part, we will decode every important asthma drug, how they work, when they are used, their adverse effects, and the high yield exam points you should never miss. If this video made asthma treatment easier for you, share it with a friend or a classmate who's preparing for exams. Sometimes one shared video can make someone's learning journey much easier. Every concept you mastered today brings you one step closer to becoming a confident healthcare professional. See you all in the next video and thanks for watching.